Hello, friends, and welcome back to yet another episode of Monday Medline, where we consolidate all the happenings in the medical world and get you the best news that can change your world and help you make informed choices. And starting off with a slightly concerning news, in the recent study conducted by the Indian Council of Medical Research (ICMR), it has been revealed that around 45% of doctors at top medical institutions are writing incomplete prescriptions for their patients. The study, published in Indian Journal of Medical Research, also found that approximately 9.8% of the prescriptions were completely wrong and 10% had unacceptable deviations. The year-long research was conducted between 2019 and 2020 in the outpatient department of tertiary care hospitals, where 13 ICMR rational use of medicine centers are located. This highlights the need for a better monitoring and regulation of prescription practice in top medical institutions. The fact that doctors with considerable years of experience in practicing medicines are giving faulty or incomplete prescriptions is a cause of worry. The study also points out to unnecessary prescribes of medications such as pantoprazole can lead to potential side effects such as abdominal bloating, edema, or even rash. ICMR recommends to implement of a standard treatment guidelines and regular audits of prescriptions to ensure compliance. It also suggests the use of electronic health records to improve prescriptions accuracy and reduce errors. It is also crucial to be informed and vigilant about our medications and prescriptions. The study highlights the need for a better training and education for doctors in prescription writing practices and implementation of standard treatment guidelines to ensure patient safety and well-being. A latest report on the health scenario in India released by Apollo Health or Apollo Hospitals on World Health Day highlights the alarming growth of non-communicable diseases or the NCDs in the country. The report states that India is witnessing the fastest rise in cancer cases, with 1 in 3 Indians being pre-diabetic, 2 in 3 being pre-hypertensive, and 1 in being the depressed, all of which significantly impacts the nation's overall health. The report highlights the importance of regular health screening in reducing blood pressure, BP, or body mass index levels, thereby lowering the risk of cardiac-related ailments. Apollo's data found that while there is a continued to be need in increasing the penetration of health checks in India, people are increasingly choosing more comprehensive health checks today than before, a positive step towards safeguarding one's health and wellness. The report also highlighted the lower cancer screening rates in India despite the high incidence of cancer cases. The most common cancers in order to occurrence in India are breast, cervix, and ovarian in the women, lung, mouth, and prostate in men, while the median age for cancer diagnosis in India being lower than the other countries. The report also emphasized the need for innovations in preventive healthcare, boosting accessibility and addressing the health inequalities to unlock the full potential of our nation and pave the way to a more inclusive and sustained development. So, staying with the hospitals, and a good thing about surgeries, partial knee replacement is set to become a more viable option in the future. With over 2.5 lakh people undergoing total knee replacement surgery every year in India, it is a very common surgery and is a better option for patients who can get away with it. In a partial knee replacement operation, only the damaged 30% of the knee surface is changed, while the remaining 70% is kept natural and intact. This is a much better option for patients with and what is natural. The newer design of the partial mobile bearing knees has made it possible and easier for surgeons to perform surgeries after a good training. It gives a lot of gratification for both patients and the surgeons. In a total knee replacement, all the ligaments around the knees, including the ACL, PCL, and the medial collateral ligaments, are removed. In a partial knee replacement, the ligaments are not to be touched at all, making the knee more natural and normal. Partial knee replacement is the future, and more surgeons are getting trained to perform the surgery. These challenges are associated with the partial knee replacement, such as certification to perform the surgery, the technical challenges of performing the surgery through a small incision, and the fear of dislocations among the surgeons. However, with more training and experiences, these challenges can be overcome. In a significant development for the Indian healthcare sector, Delhi-based Akums Drugs and Pharmaceutical Limited has announced the production of hydroxyurea, a crucial medicine used for treating sickle cell anemia at a highly affordable price. The drug will be now available in India at just Rs 600 per vial, at a staggering less than 1% of the cost of the imported version, which is typically priced around 77,000 per vial. The move is set to revolutionize the treatment of sickle cell anemia in the country, making it more accessible and affordable for the masses. Sickle cell anemia is a genetic disorder that predominantly affects the tribal population, with approximate 1 in every 86 births being diagnosed with this disease. The condition affects hemoglobin in the red blood cells, leading to the significant modified or morbidity and mortality. The availability of hydroxyurea at such lower cost is expected to significantly improve the quality of life of those affected with the disease. What sets the Indian variant of hydroxyurea apart from its global competitors is that not just about its price but also the storage condition. While global brands require specific storage temperature between 2 to 8 degrees, Indian version remains stable even at the room temperature. This feature makes it particularly stable for its use in the rural and tribal areas where maintaining the specific storage conditions can be challenging. Indian pharmaceutical companies are demonstrating their potential in producing high quality medicines at a fraction of the cost of the imported versions. It also instills a sense of pride as it showcases India's capabilities to produce self-reliant in healthcare sector, aligning with the visions of healthy and self-reliant India. And that's a wrap on this edition of Monday Medlines. We have dwelled into crucial health updates and insightful topic. Now it's your turn to join the conversation. Share your opinion and thoughts on the issues we have covered in this hour of Monday Medline. Stay tuned for more exciting updates coming your way in the next week. Don't miss out on the latest news and insights. Hit the subscribe button and ring the bell icon to stay informed. Your engagement fuels the heartbeat of Monday Medline. So until next time, keep exploring the realms of health and well-being with us. And remember, your health is in your hands. Take care, stay informed, and we'll catch you in the next edition of the Monday Medlines.